We like to eat a lot of good stuff. And then we have got dietary intervention coming up. And I think this is, we all know as gynecologists. So the dieting is an important part of the whole journey. But coming to the exercise intervention, this is very important for us, very important for us. And then they have given age-wise, 18 to 64, what they should be doing, and then they've given to people who are in various age categories how much they should exercise. So 18 to 64, or it is in adolescence. So they have divided how much they should be exercising, and then this we can just see ourselves. They say that it can be around 150 to 300 minutes per week moderate workout, or 75 to 150 minutes per week high intensity
Happen
workout.
Jyotis.
It is per week. It is per week. That's very important. And the food should be of low glycemic index, diet index. This is about, I've spoken to you about diet and exercise,
देखो कहाँ
and both of them are important in terms of our having good outcome. Now, this is that, as somebody said, the first line can be exercise or dieting. So the woman should aim to lose around 10% of their body in the first year for the having better clinical outcome. And then they talk about the same thing about the exercises, what type they should do. It should be moderate intensity, aerobic activity. All the things have been given here. But remember that diet and exercise are two important pillars. And here again, just want to show what actually happens. What actually happens when the PCO patients are doing moderate workout or an intensive workout. It can lead to increase in the beta amino amino butyric acid. We call it BIBA, and it can lead to uncoupling proteins can increase.
ये वेट कर
This,
जिसका मतलब फिर
this uncoupling proteins can lead to loss of visceral adiposity and reduce fat accumulation, and then it can reduce hyperandrogenism. So they say that in case we give somebody on this sort of an exercise, this is where it acts. It can lead to increase in the UCP1 and GLP1 expression. And they all lead to final reducing the LHFSH ratio, GnRH pulsatility, IR, and finally it'll reduce the hyperandrogenism. So we were reading about how we have PCO affecting us, but now going to the molecular level, that's the way the things work. And they're talking about the UCP1 and GLP1 expression. But then now I move on to some small glimpses of our academy. I wanted to say hello to all of you in case somebody of you is present over here. Love to hear from you. These are few old pictures or of our academy, some memories. I can't move on without showing you these. These are around 4 to 5 years old, and the journey is still on, and we are doing good work with your blessings. And these all are our batches which had come all over the
हाँ
country and the
हाँ
world. And this is few of our prize ceremonies. People are happy, enjoying themselves. This is learning embryo culture, making embryo droplets. About the curtain raisers, today we are talking about the Poseidon criteria. So today we are on PCOS. The last class was on Poseidon criteria. That was on 21st of January. Next we have is on endometriosis, then we have on RPL. So in case you're free, do join us on 18th February and 6th of March. Today we are on PCOS 2026. What are the new guidelines? And then we have endometriosis. RPL is going to follow it. We have a little program called Alumni Grooming Program where we invite people to do some public speaking, to make some videos. So in case any one of you wants to join us and join our Facebook Live programs, we have the upcoming ones on male infertility we just had. We have one on ART donor compliance and insurance in India. Then we have costing of IVF and IUI cycles. So in case you're free, do join on these dates. And in case you want to be part of it, we've got more than 4 million views, which we have got with all of you being the. I just saw Vandana is sitting over here. So as you join, we get good number of reviews, and I think that gives us more confidence. So this is in case you're keen, you can join us. This is a new Facebook Live we are doing. This is on donor and insurance in the country. Very important one. and 970 views. Thank you so much for this. We've got approximately 2200 videos which we have on our website. If you want to watch our videos, most welcome. You can go and watch them. The curtain raiser package is already there. In case someone wants to purchase CR package, you can contact us. We put on. So moving ahead, our courses, course 1, course 2, course 3. Course 1 is on the lab setup. We are aware of that. And that's on embryology and lab setup. Our course 2 is on semen and IUI prepare and sample preparation and andrology. And our course 3 is on training in IVF. So these are three
चलो ना दे
courses we
रहे हैं
have. You can always join us in case you want to. And few little videos of our training
I will
about
try to
loading the
go through this. I've taken half
teaching
ml of
people
the
how
media
does an
here,
embryo
fine,
behave when we are loading it.
and I will flush this catheter and try to load these babies for you. So I'm just very gradually going and
So we are
flushing
working
it.
on blue babies and
Done.
trying to load them in the catheter
मैंने कितना लिया?
and
0.5
train
लिया.
how they work.
और देखिए क्या होता है अभी. So see my things properly. Patient and
So
you are
it's
able
quite
to
a
see
lot
this very
hands-on.
nice.
नहीं खानी है
देख पा रहे हैं इसको?
We try to
मतलब
we
उसका
try
बारह
to
सात को
simulate
देख रहे हैं
we try to
इतना
simulate
clear
how
है?
it works there,
तो बहुत
as you can
लंबा
see
खाना पड़ेगा
on the screen.
Media column to lock it. Done. Now I
So
will take one
we teach how we
air
load our
column.
embryos.
This will be my first air column.
So we're making air
Done.
columns, learning how to make air
And
columns
now
for
I
an
will
embryo
go
transfer.
and pick up my embryos.
So making embryo columns is important for us. And then we have a lot of trainings on andrology also, where we learn about how do we do DNA fragmentation index, seminology, andrology, everything is hands-on. I think it's a very memorable experience for anyone. So just to show some pictures who all were here. I think you'll be able to spot some of you who are present here. And then
I have enrolled
we
for
have a lot
the
of
course here
training
under
on
batch
drugs in
137 in
IVF.
course 3, and I'm here to learn today, and we are studying about the stimulation drugs for the IVF cycle. I'm going to talk about the FSH injection that we use for ovarian stimulation. FSH is available in either recombinant form or urine.
And we have a lot of things on OPU going.
Hello, I'm Dr. Jyoti.
That
I'm from
interests
Agra. I'm
everyone.
demonstrating about this negative pressure effect when we aspirate during ovum.
नहीं ये
So
भूल
here
जाएगा
I'm putting my
हाँ
ovum needle on the follicle, ovarian follicle. First, there will be a little bit of mechanical pressure. Should I put pressure? Go.
We're trying to simulate.
So it doesn't bust out,
the negative
and
pressure
the follicle
that it is not
gradually
ruptured now.
deflates, and we get the follicle. When we do the ovum pickup, the negative pressure should be started just before we touch the wall.
Or first one.
Absolutely.
Hello, I'm
So the
Dr.
simulator so
Priya,
that people can
belonging
work. And
138
learn
classes
how
of Dr. Pankaj sir's course. So I've joined all the three hybrid courses here. Now to show you how we are going to do a ovum pickup in a simulator.
this is very comprehensive
So
learning with all of you. So we
now I'm
do
inserting my
large
needle
amount
into
of
the
andrology,
ovarian.
pick up on simulators,
Now I'm piercing the vagina.
learn about
I have
embryo
come
transfer.
inside,
So
and
this
now
is
I'm
somebody
going
trying to
to
demonstrate how to
insert
do
the needle into
OPU
the egg.
on the
As you
simulators.
see,
And then again, a little video on embryo
Hi,
transfers.
I'm Dr. Leena
Microscopy.
Mehrotra from
You
Moradabad.
can
I'm
see
here
air
for
columns
Dr.
very
Talwar's
beautifully
course.
here and here.
And this is, we have this Hager's hysteroscopy system here. And I am doing this resection of polyp.
So this is learning how to do polyp
Instruments
resection
are good.
on
This is a good training way, because with the hands-on thing we get an idea how to proceed with in a patient. And these things I personally feel these exposures are very good at Dr. Talwar's place. And this is, again, you can see the polyp being removed here with the scissor. Thank you so much.
You can see air
the
columns
polyps.
very beautifully here and
And if
here.
we're learning
This
embryo
contains my embryo.
transfers, how we load the catheters, and
And
it's a good
these
catheter
are the
for
two
us.
are the ones which are seen during the embryo transfer. The catheter won't be seen. An embryo lie here. You got a very smooth delivery because we have had a full bladder. Now, full bladder is the wrong.
So moving ahead with some more memories, then I go to the class, and I think we have by now understood the basic. We have learned about the how the PCU can affect our body. There is hyperandrogenism. We have got hirsutism. We have got PCO morphology, ovaries, and all the things are always a challenge to us for a young girl or for any woman. And when they have infertility along with that, that makes it more challenging for all of us. And these are few of the pictures of our recent batches, and I think I can't move without saying hello to them. And I can't speak to all of you, but I miss all of you. I'm sure that a lot of you will be here in the background. We all miss you. And this is one
Yeah,
of the
that's so true.
few images. And we have got Alumni Connect program. I think all of you should join. All alumni should join. We just had one on New Year Eve, and we also had one on 26th of January. The different topics we cover. This was we keep having it on every national holiday when we are all at home. That's a very important thing. One.
I had joined USG training
This
under
is the
Dr.
ultrasound
Talwar, and I'm so
training
blessed
module.
because of the structured curriculum and practical training he has.
It's, we got multiple 3D ultrasound training courses. In case you feel free, you
It's very,
can join.
very difficult to
Where
get
we
here
try to learn from
because
color Doppler,
I have
velocimeter,
to go to the carotid.
and
So if
many
I go to
things.
my carotids, I should be able to go to color, go to the color flow.
Uh,